So I'm doing a dressing change for a straight cut. First, what I'm going to do is I'm going to verify the order, and then I'm going to perform hand hygiene, put on some gloves, and then I'm going to introduce myself to the patient. Hi, I'm Eric. I'll be your nurse this evening. Can I get your name and date of birth?
Austin Dominguez, 1/29/2000.
And then, do you have any allergies?
No.
Okay. So I'm going to provide privacy and explain to the patient what I'm about to do. I'm about to do a dressing change. It should be painless. Try not to move a whole lot while I'm taking off your bandage. So I'm going to raise the bed up to the right height, and then give my patient their mask. And then I'm going to put my mask on and set up my sterile field. So, I'm going to leave that there. Okay. So now I'm going to go ahead and palpate for tenderness and pain around the area. Do you have any pain or tenderness in this area?
No.
Alright, so I'm going to go ahead and remove it, starting from the outside, working my way in. Being careful to stabilize the line. These gloves are not good. Really careful on this part right here. Alright. So discarded this. And then I'm going to take off my gloves, perform hand hygiene. And then I messed up my sterile field or my gloves. Alright, so obviously I broke my gloves. If this is the case, I would restart with some sterile gloves. Since I only got one pair, I keep going. It's a little too small for me. Alright, so from here, discard that. Going to grab this. So I'm going to clean this for at least a minute, going back and forth. Clean the area with the chlorhexidine. Okay, so I'm gonna go ahead and let that dry for 30 seconds, and I will apply the skin protectant. Alright, so I'm also going to let that dry for 30 seconds. While I'm doing that, while that's drying, I'm going to set up my saline flush. Prep it, make sure no air bubbles in this one, which is good. Okay, so now I'm going to put the stabilization device on around it. And then apply the new dressing. Be careful to push down and get all the air bubbles out. Alright. So set that there so I can label it in a minute. Okay, from here I would measure, verifying that it matches what the order state for the length. So I'm going to go ahead and say that it is good. And now I'm going to take the cap off. Actually, I'm going to prep this real quick before I take the cap off. So this is alcohol to clean the end of the cap, at the end of the line, I should say the lumen. Take this cap off. I'm going to twist the saline on. I'm going to draw back on it. I'd verify blood flow when I pull back. This one isn't hooked up to blood, so I can't do that. So I'm going to go ahead and flush it with saline, doing the push-pause method. This should be over a 1 minute duration. I might go a little bit faster for the sake of the video, but push, pause. Push, pause. And also note that there is air bubbles in here. I'd obviously get that out beforehand. I forgot to do that. Making sure it's not coming out the back of it. So I'm going to go ahead and unhook this. So I'm going to clean it again, the outside of it. You can even clean the outside of the line too, going down that. And then you're going to apply a new cap. This is the old one because we only have one cap in the lab. I'm going to reapply a new cap. And then from here, I don't have to be sterile. Take the gloves off. And then I will place the label on there. I don't actually have a pen, but I would put my initials, date and time on it. I had magically found a pen, so I will do that. What is it? 12:30. Make sure to also put military time. Can you do this? Alright. Alright, so I'd make sure the patient's comfortable, lower the bed, perform hand hygiene, and then document everything I did.